Hello, welcome to part 6 of Physiotherapy question and answer MCQ series. Let's move to question number 126. In pulled elbow syndrome, there is a dislocation of option A, radiohumeral joint, option B, radioulnar joint, option C, humeroulnar joint, option D, all of the above. And the answer is option B, radioulnar joint. Now let's move to question number 127. Locking of knee joint can be caused by option A, Osgood-Schlatter, option B, loose bodies in knee joint, option D, tuberculosis of knee, option D, A and B both. And the answer is option D, A and B both. Now let's move to question number 128. Deltoid ligament is attached to all except option A, medial malleolus, option B, medial cruciform, option C, spring ligament, option D, sustainiculum tali. And the answer is option B, medial cruciform. Now let's move to question number 129. Presence of which of the following condition in urine are indicative of diabetes mellitus? Option A, uremia and renal calculi. Option B, ketosuria and glucosuria. Option C, renal calculi and hyperglycemia. Option D, uremia and ketonuria. And the answer is option B, ketosuria and glucosuria. Now let's move to question number 130. Crossed hemiplegia means dash. Option A, lesion above pontine. Option B, at the level of pontine. Option C, below pontine. Option D, none of the above. And the answer is option B, at the level of pontine. Now let's move to question number 131. Site of injection in gluteus. Option A, inferior medial. Option B, superior medial. Option C, superior lateral. Option D, inferior lateral. And the answer is option C, superior lateral. Moving to question number 132. In rehydration therapy, ORS used means option A, oxygen replacement therapy. Option B, oxygenator respiratory solution. Option C, oral rehydration solution. Option D, optimal recovery set. And the answer is option C, oral rehydration solution. Moving to question number 133. External rotation of glenohumeral joint is checked by option A, medial glenohumeral ligament. Option B, inferior glenohumeral ligament. Option C, anterior coracohumeral ligament. Option D, posterior coracohumeral ligament. And the answer is option A, medial glenohumeral ligament. Moving to question number 134. Usually the direction of elbow dislocation is dash. Option A, backward. Option B, backward and lateral. Option C, backward and medial. Option D, forward. And the answer is option B, backward and lateral. Moving to question number 135. An S3 heart sound is often associated with option A, CHF, congestive heart failure. Option B, COPD, chronic obstructive pulmonary disease. Option C, atrial fibrillation. Option D, ventricular fibrillation. And the answer is option A, CHF or congestive heart failure. Moving to question number 136. Osteochondritis of epiphysis of femoral head is known as option A, kidney box disease. Option A, Pearse disease. Option C, Clash disease. Option D, Planner's disease. And the answer is option B, Pearse disease. Moving to question number 137. The name of the coil used to produce Faradic current in the past was option A, Koch coil. Option B, smart Bristol's Faradic coil. Option C, induction coil. Option D, none of the above. And the answer is option B, smart Bristol's Faradic coil. Moving to question number 138. Which of the following enzyme breaks down the starch to maltose? Option A, amylase. Option D, lipase. Option C, trypsinogen. Option D, pepsin. And the answer is Option A, amylase. Now let's move to question number 139. For meniscus injury, there should be option A, shear of compressed knee, option B, torsion of the compressed knee, option C, shear and torsion of the knee, option D, torsion of extended knee, and the answer is option B, torsion of the compressed knee. Now let's move to question number 140. When is the first polio drop is given? Option A, soon after birth, option B, after 15 days of birth, option C, 7th day of the birth, option D, 6th month of the birth, and the answer is option A, soon after birth. Now let's move to question number 141. Inversion-eversion component is more in option A, ankle joint, option B, mid-tarsal joint, option C, subtalar joint, option D, none of the above, and the answer is option C, subtalar joint. Now let's move to question number 142. Large and possible strong bone is possible. Option A, excising in adulthood, option B, excising in childhood, option C, excising after growth phase, option D, remaining physically active in childhood and adulthood, and the answer is option B, excising in childhood. Now let's move to question number 143. A person who is standing on both of their feet is stable when option A, their base of support is as wide as is comfortably possible, option B, their center of gravity is above their base of support, option C, their center of gravity is close to their base of support, option D, position of their center of gravity and base of support coincide, and the answer is option A, their base of support is as wide as comfortable possible. Now let's move to question number 144. The ligament that extends from the inferior edge of the ulnar radial nose to insert into the neck of radius is option A, annular ligament, option B, caudate ligament, option C, oblique cord, option D, none of the above, and the answer is option B, caudate ligament. Now let's move to question number 145. Joint reaction force is option A, compressive force in the joint, option B, compressive force and muscle compressive force, option C, compressive force and muscle rotatory force, option D, compressive force of muscle and other soft tissues, and the answer is option B, compressive force and muscle compressive force. Now let's move to question number 146. The radioulnar joint is a diarthroidal uniaxial joint of variety. Option A, saddle joint, option B, plane joint, option C, pivot joint, option D, condyloid joint, and the answer is option C, pivot joint. Now let's move to question number 147. The carpal arch is supported by ligament known as option A, carpal ligament, option B, flexor retinaculum, option C, transverse ligament, option D, none of the above, and the answer is option B, flexor retinaculum. Now let's move to question number 148. Static stabilization of glenohumeral articular surface is provided by option A, coracohumeral ligament, option B, coracoclavicular ligament, option C, superior joint capsule, option D, glenoid labrum and capsulo-ligamentous component, and the answer is option D, glenoid labrum and capsulo-ligamentous component. Now let's move to question number 149. The smooth muscle of the bronchial airway is innervated by which of the following nerves? Option A, intercostal nerve, option B, phrenic nerve, option C, thoracic splenic nerves, option D, vagus nerve, and the answer is option D, vagus nerve. Now let's move to question number 150. The concave convex rule depicts if the bone with convex surface moves on the bone with convexity, the convex joint surface. Option A, move in the opposite direction to the bone segment. Option B, moves in the same direction to the bone segment. Option C, halfway in opposite direction and another halfway in the same direction to the bone segment. Option D, none. And the answer is Option A moves in the opposite direction to the bone segment. That's all for today. If you need further clarification, check the description box and give your feedback in the comment box. If you like this MCQ section, do subscribe to this channel for watching part 7 of this series. Thank you.